Hello everybody, and thank you so much for joining us for another exciting DENTCA webinar. My name is Dr. Yaron Gabel and I am the clinical advisor of the company. Today I want to talk to you about how to revolutionize full mouth implant supported prostheses in your practice. For those of you who are not familiar with the DENTCA company, it was initially founded by 7 dental professionals back in 2007, and the idea was to make full mouth restorations a lot easier to make. As you know, they take a lot of time and very complicated processes to make up full mouth prosthetics. So they wanted to come up with a new system that would allow you to finish cases in less appointment with a lot less steps as conventional. So after much research around 2011, they launched officially as a company with a very unique trace system that would allow you to take your final impressions, vertical dimension, and CR tracing records on the same patient appointment, and then combine it with top-of-the-line CAD technology to be able to design very unique dentures that would have superb fitting. And through 3D printing technology, they would send you a trine that you can place in the mouth and even evaluate retention on your second appointment, and then conventionally processed to make a final denture. Recently, DENTCA is also the proud creator of FDA-approved 3D printable materials for base and teeth, and they launched the first fully FDA-approved 3D printable monolithic tooth and base dentures in the market. If you'd like more information about the printable dentures, please visit us at www.dentka.com. Now, to get more into the product I want to talk to you about today, we know full mouth restorations range a lot from all the way from conventional dentures to full mouth fixed implant supported dentures. I'm talking about all-on-4, all-on-6 restorations. And especially those who are fixed by implant are fantastic. They increase the chewing efficiency of our patients. They increase the temperature and taste perception since we don't have to cover the palate. And as you know, we have taste buds on the palatal area as well. It does not press down on the gums, and it does not dislodge when eating, so it actually allows the patients to regain their chewing and eating habits, just like they did when they initially had their own teeth. But you know, as these treatments go higher and higher in quality, they also cost a lot more money, and this is mainly because of time. It takes 7 to 10 appointments to make these restorations. It takes a lab a lot of time to create them, so you're probably looking about 2 to 3 months to create a much more complex restoration, such as an all-on-4 or an all-on-6. There's also the time involving with the surgical component if you're also placing implants, and the difficulty of the maintenance appointments as well. You have to see these patients every 3, 4 months or 6 months to make sure everything is correct. You have to keep ordering parts, and everything translates into time and money. There's also difficulty with matching bars and implants and bars in the superstructure in the case of your hybrid dentures or your all-on-4 restorations. You know more often than not that you're going to end up having to saw and or solder these restorations in order to make them fit. You have to worry about multi-unit abutments. You have to make sure they're all parallel to each other when it comes to implant placement, and you need to make sure everything fits right, which takes a lot of planning and a lot of time. And there's also a lack of consistency when duplicating fractured restorations. So whenever we see a picture like the bottom, we know it's not going to be a nice day at the office. We know we're going to have to retake impressions. Most likely we're going to have to remake that bar, create a new superstructure, and then the patient, more often than not, will tell us it doesn't quite look like the one he initially had. And you do know at some point you will need to exchange these restorations, whether it's 5, 10, 15, 20, 30 years, you will need to replace them at some point. Would you rather rely on a technology that would allow you to create a duplicate at the push of a button? Or would you rather keep taking impressions every time some issue happens with your fixed full mouth restorations? So in order to overcome all these challenges, DENTCA launched their newest product called DENTCA-4, which is a full mouth fixed implant zirconium or PMMA superstructure which is attached to segmented titanium bar technology. I'm really excited about this new product. Personally, I believe it's going to end up replacing hybrid dentures and all-on-4s altogether, and hopefully implant overdentures as well. Regarding the bars, each bar is custom created to your implants. So if you place an implant at X angulation, the bars will be designed to correct that angulation for an easy vertical insertion of your superstructure, which means you can place implants at any position and any angulation that you want in order to do your cases. So you no longer have to worry about multi-unit abutments. You no longer have to worry about implants being parallel to one another, since your bars are going to be directly engaging into the hex position of your implants, giving you a passive connection. Another great thing about the bar technology, since it's segmented, it allows you to much easily plan your cases. It will give you full cantilever support, and once the superstructure is connected to it, it will give you a splinting effect and cross-arch stabilization. So you don't have to worry about forces being unequally distributed. Everything is automatically calculated by the computers on our company. Another great advantage of the system itself is, since we're milling the whole superstructure together, gums and teeth, we don't have to worry about minimal space required as well. Most of the all-on-4 restorations will require you to secure about 18 millimeters in space, forcing you to remove a lot of bone on your patient. In here, since we don't attach physical teeth to the base, but rather actually mill it out together, we only require about 6.5 millimeters of minimal space per arch, which means you might not need to remove any bone at all, unless you actually have any aesthetic concerns that would force you to remove bone on your own. Another great aspect of the DENTCA-4 system is the fact that we designed the bars and the superstructure together, so you get good tissue continuity between the bars and the superstructure. We give you about 100 microns of space between the bars and the superstructure, and about 0.5 millimeters of space between the bars and the gums, so the patient can easily clean with the water pick. It uses the same state-of-the-art CAD/CAM technology software that you might have experienced before with the DENTCA dentures. It allows you to create easy duplicates, since we keep digital files of all of our designs, and you can also have simple maintenance appointments. As you may be realizing on the picture on your right, the superstructure is attaching itself to the two most posterior bars via two screws, and you would place temporary cement on the anterior bars. So all you have to do in your maintenance appointments is remove your two screws, separate the restorations, have your hygienist or your assistants just clean out the area, apply fresh temporary cement on your anterior sockets, and just secure it again and place your screws in there. So it will probably take you about 20 minutes, 25 minutes instead of the hour and a half that it would normally take you on your conventional for maintenance appointments. Now everybody asks me, okay, so I'm sold, I want to start doing a case. What is it that I need to send you in order to successfully do a DENTCA-4 case? Well, first thing we need to have is we need to make sure our patient's implants are already fully integrated. DENTCA-4 is not a system that qualifies for immediate implant loading. If you do want to do immediate implant loading, we do have another solution which I'll talk about near the end of our presentation. But for now, if you do want to do a DENTCA-4 case, you do need a patient whose implants are fully integrated. And in terms of records, we'll need an implant relationship record, whether it's an implant level, open or closed impression, or if you have an intraoral scanner, you can get your scan bodies and scan the arch with them. And we'll also need a VD and CR records, which you can either do with the DENTCA trace or you can do with the CBCT scan. So let's start by talking a little bit about what you can do if you have digital technology in your office. So the most common records that we would get at DENTCA are, as you can see in front of you, is an open tray impression to give us the implant relationship, and a CBCT scan of the patient wearing their current dentures, whatever temporary restorations you have them on. Just make sure that when you take the CBCT scan, the patient is not biting on the biting stick, as we use the CBCT scan for VD and CR records, and the vertical dimension could be altered with your bite stick. If you do, as I mentioned before, if you do have an intraoral scanner, you can also go impression-free, which is what doctors are really trying to accomplish nowadays in their offices. So in order to go impression-free, what you will need is, as I mentioned before, place your scan bodies directly into your implants, screw them in, and then use your intraoral scanner to take a full arch scan that more or less is going to look like what you see in front of your screen right now. If you have two arches, then also do the lower arch. If it's going to be opposing a actual dentition, then also do a scan of the lower arch. And if you are wondering which implants we support or which scan bodies we sell on our website, you can acquire those scan bodies directly on DENTCA.com. We do support a couple more implants than what you see on this list. If you have a question about which implants we support, just call our CS department and they will be more than happy to help you with the question. Now, if you don't have access to a CBCT scanner or intraoral scanner, then you can also use the DENTCA trace. This is especially important if you're doing a single arch that's opposing a denture. As you know, if you were to do an upper single arch that's opposing lower natural dentition, we would be able to see the teeth on the CBCT scan. However, if it's opposing a denture, we would not be able to see the dentition on the CBCT scan. So unfortunately, this is the one instance where you would need to use the DENTCA trace or wax rinse for that matter in order to let us know what the vertical dimension and the bite is. If you're going to be using the DENTCA trace, as you may be familiar, DENTCA trays come in 4 different sizes. They're thermoplastic in nature, which means they can be modified on an open flame. And the way you would do it is a little different from your regular DENTCA tray usage. We're going to be removing the posterior attachments as they're not necessary, and we're only going to be using heavy body this time. So you would take the corresponding DENTCA tray, depending on your patient's arch size, fill it up with heavy body, seat it on the arch, and then select one of these upper or lower single arch attachments if you're doing a single arch case. Add a little bit of bite registration to the single arch attachment and copy the shape of the dentate arch so it's stable. And depending on which you're doing, whether it's a lower single arch or an upper single arch, you will either attach a central bearing pin if you're doing a lower single arch, or you would screw in the central bearing pin to the lower single arch plate. And then you would attach one of the easy tracers that we'll include with your start kit if you order one online. And this is kind of like an etch-a-sketch that will allow you to do your CR tracing. So put them back into the mouth, and the screw that you see, the central bearing pin, will go up or down to help you get your vertical dimension first. And then you can do your CR tracing. You can do this in one of 3 methods. Either you can do Gothic arch tracing, which is protrusive, retrusive, and then your lateral movements to create a very precise arrow that will tell you where your central bearing point is. Or you can do simplified tracing, which is just protrusive and retrusive. If everything fails, just guide your patient through centric and have them open and close several times. Once you know where your centric point is, just drill a dimple where that area is and have the patients lock into that dimple. So have the central bearing pin lock in there while the patient is wearing the trace, and just fill out that space with bite registration. Also, if you're doing a single arch, do not forget to include a stone model of the opposing dentition. So if you're doing a single arch upper, don't forget to include a stone model of the lower dentition. Also, a good idea is if your patient really likes their current dentures, I would recommend to also submit a stone model of the existing denture so we can copy the tooth shape, tooth size, and position as close as possible. Now, another thing that we will need from you is a picture of the patient either wearing the DENTCA trays or wearing their existing dentures so you can get a relationship of their facial features. As you know, DENTCA designs their cases by the use of algorithms and anatomical averages, so we will contextualize 28 anatomical landmarks inside the mouth and calculate everything through our software. So it'll find, for example, that mean palatal suture and that incisive papilla to establish your midline. Sometimes we do get patients that would have a fractured nose, so if that's the case, the picture will really allow us to understand where our midline should be, going by the external facial features versus the internal anatomy. Pictures can be taken with your regular digital camera and then uploaded to our website, or if you want to go for simplicity, you can open your phone's browser and just type m.dentca.com, and that will launch an app that will allow you to snap a picture of your patient. Once you're done uploading everything to the cloud through our app, it'll give you a picture reference number. It's really, really important that you write this number down and reference it when you place the order on our website. Once you took the picture, select your shades. We do have light pink, light reddish pink, original pink, and dark pink for the gum shades, and A1, A2, A3, A3.5, B1, and B2 for the tooth shades. We're constantly adding more tooth shades, so if you're unsure if we carry another one of the shades you desire, just call customer service and ask us if we have that corresponding shade. We're constantly trying to add more and more shades to our cases. And lastly, you can choose from ovoid, squared, or universal, which is square taper for your tooth shape. We also have 4 tooth sizes, which you can select by requesting a mold chart from our CS team, or just look at the numbers that you're seeing on the screen and try to determine the mold size from what you see. If you don't select the mold size, the software will select it for you based on the arch width and length. Once you're ready to place the order, just go on to DENTCA.com, log in, and place the order. If it's your first time on the DENTCA website, it will be necessary for you to create an account. You can create an account by clicking on the sign up button on the upper right corner of our website. It'll ask you 5 simple questions, basically what password and username you would like, what your dental license number is, and a couple other simple questions, and then it'll log you in. Click on orders, select the product that you want to place an order for, and fill out a prescription form. If you took pictures with your camera, there's going to be a box at the beginning of the order section that will allow you to upload your pictures. And then at the bottom of the ordering page, you can upload your CVCT or intraoral scans in the case that you actually took those. Or you can select the mail physical impression in case you took regular impressions, and then add any other special instructions that you would like. If you did actually take physical impressions at the end of your order, it will allow you to print a shipping label that you can ship your cases through FedEx back to us. Now, many people ask me, well, what is it that you do, or how do you model these cases? So the way it works is as follows. If you actually took regular impressions, we're going to scan those impressions, and we are going to obtain a scan that more or less looks like what you see on the middle picture. We're going to remove any excess areas that are not necessary or relevant for what we're doing, and then we're going to digitally articulate the case based off of the vertical dimension and the bite relationship that you gave us. This is more or less like mounting a case on the articulator. And then we're going to overlap that open tray impression or scan body impression that you provided us to get the implant relationship in place. And this will tell us what implant angulation and position we have. And then we're going to generate the bars, as you see in the bottom left picture. And this will be done by obtaining the hex position on your implants and then generating each bar to match your implants accordingly. You can even use different implant brands, and we will still be able to design the case for you. Once that's done, we're going to set the teeth based off of the tooth size and tooth shape that you selected, and then we're going to generate the gum shells to create your case. Once the case is ready, we're going to mill the bars from a titanium block, and then we're going to mill a provisional for you to deliver. This is going to be an acrylic provisional that you can deliver on your second appointment. And we're also going to 3D print you a washable trine so you can take a bar pickup wash as well. So second appointment comes in, you're going to get a form that will allow you to express any changes that you would like. And also, it allows you to troubleshoot a little bit. So if you get stuck in an area, you want to change the bite, it kind of tells you what steps to follow if you want to change that bite. Please do bear in mind that even though this form is included with your cases, you will need to request all adjustments on the website. In order to do that, just go back, log in, click on My Account and Orders, find the order that you initially placed an order for, and then click on there to request the adjustment/process to final. So essentially what we're going to be doing on the second appointment, we're going to be making sure our bars fit properly. We're going to check our deliverable trines, make sure the occlusion is good. Any other aspects that we want to check, such as vertical dimension and midline, should also be revised then. So as I mentioned before, you will get several things. You will get 1 bar per implant and 1 screw per bar. These screws are going to be the same screws that you normally use for your implant system, and you can screw them in with the same screwdriver that you normally use for your implant system. And we will also include 2 DENTCA screws as well, so you can secure the superstructure to the 2 most posterior bars. It will also include a washable 3D printed trine that you will be doing a wash on, and also make any markings that you would like to do. You can identify this washable trine by the fact that it does not have posterior screw holes, and it only has 2 sockets instead of 4, 5, or 6, depending how many bars you created. And then you also get a milled acrylic provisional that you can identify again by the screw holes on the posterior section. First thing I recommend you to do on your second appointment is place take your deliverable provisional and place all of the bars in their corresponding sockets. They only go in one way and they only fit in one of the sockets, so this is a really easy way to determine where your bars should go in reference to your restorations. Otherwise, you're going to find yourself putting a bar in the mouth and then realize it's on the wrong implant. So this really helps you get a lay of the land, especially if you're doing 6 implants per arch and you're doing 2 arches, you're going to get 12 bars. So it would be really hard to determine what to do. So once you remove your healing abutments and you place your bars, you will tighten them to 30 Newton centimeters. And then we're going to try in our washable trine first. It is very, very important that if you're going to make any markings, you make sure you make them on the washable trine and not on the deliverable provisional, as the provisional will stay in the patient's mouth. So once we have evaluated our washable trine and make any necessary markings, if any, we're going to take it out of the mouth. We're going to apply PVS adhesive to the intaglio, and then we're going to apply light body PVS to it. It's important that you don't fill out the sockets completely with light body PVS, as you risk having the washable trine lock into the mouth when you're trying to remove it. So only fill it out at about a fourth, maybe about half of the size, and you'll be able to do a successful bar pickup. The reason we request a bar pickup is to ensure that there were no changes in bar position when the bars are in place. It will allow us to make one final confirmation of the bars before we make your final restoration. Once you're done with that, if you need to take a bite, by the way, just retake the bite with PVS by having the patient wear the washable trine and then take everything out of the mouth. And you will then take your deliverable provisional, fill the anterior sockets with temporary cement. You can use Bond or any brand you want. The easier to remove, the better. There's only about 40 microns of space between the bars and the superstructure. So it's really only meant to fill out the gap and create a little bit of a vacuum. Seat it in the mouth, remove any excess, and then put the 2 posterior screws and tighten them to 10 Newton centimeters and adjust the occlusion if necessary. Send the washable trine back to us, and the patient will wear this deliverable provisional for about a week and a half. Now, many people ask me, well, it's all in one color, and that is true. We mill it out of a PMMA block in the color of the teeth. If you like, you can build up the gums with composite or stain them with certain colorings. Honestly, he's only going to be wearing it for about a week and a half. I wouldn't worry too much about that. And then once we get the washable trine back in the office, what we're going to do is we're going to scan the wash, we're going to apply the new wash, and anything that you request to be changed will be applied, and then we're going to generate you a final restoration. We're either going to create a PMMA final with layered composite for the gums, or a zirconia final restoration with layered porcelain for the gums. And then on the third appointment, you're going to deliver your final restoration. All you have to do is remove your screws, remove the provisional, clean out any areas where you have excess cement, apply fresh cement into the final restoration, seat it, and apply the 2 posterior screws and tighten them to 25 Newton centimeters. And then the patient can walk home happy. Now, a few special considerations for your cases. Water pick is a must. For sure, they have to use the water pick. We're going to give you about 0.5 millimeters of space between the bar and the gum so the patient can clean properly. It's very, very important that they clean up every day. I would see the patient every 3 months for the first year to ensure that they're cleaning properly. And then you can decide to switch them to every 4 to 6 months depending on how well they're cleaning after that. Now, many people also ask me, well, that is fantastic if all the implants are fully integrated, but what can you offer us if we are planning to do a case straight from extractions, or if we want to do immediate loading? Well, then you got to ask yourself, if your patient is a candidate for immediate loading, you can request a new product called DENTCA-4, which also comes with a surgical stent. It'll come as a pair. You would make your extractions, place your implants, and then you will put temporary cylinders on the mouth and then relieve the DENTCA-4 on the areas where the cylinders would be, seat it all the way and fill the spaces with acrylic. Once the occlusion has been adjusted, you can unscrew the restoration and remove the palatal section, and then the patient would have something fixed on the same appointment that you place the implant. If the patients are not candidate for dental extractions, then you will need to give them an immediate denture instead. We do offer immediate denture services as well through our 3D printed dentures. If you do want to learn more about either the DENTCA-10 or the DENTCA Immediate, please visit our website or call our customer service team. They'll be more than happy to assist you. If you're wondering what types of records you will need in order to do either a DENTCA-10 or a DENTCA Immediate, it's really, really simple. All you have to do is either send us an upper stone, lower stone of the actual dentition and a PVS bite, or you can take the intraoral scanner and scan the upper arch, lower arch, and bite as well, and submit those files alongside with an order. Now, many people ask me about pricing. I really recommend you to go to the website and look at pricing. I don't want to mention pricing right now since this webinar will be up for a long time and pricing could change. But please visit our website for more information on pricing, turnaround time, and any other questions that you may have. Please call customer service or call and ask for me, and I'll be more than happy to answer all the questions that you may have. Thank you so much for joining us today. I hope we'll be able to hear from you soon. If you have a case and you want to talk about it, I'll be more than happy to talk to you over the phone. Talk to you soon. Thank you so much for joining our webinar.